As far as other topics that important for me and others with SMA to discuss during appointments, treatments are a big part of it, but you keep in mind that FDA approved treatments only started in at the end of 2016, and I was going to clinic well before then. So there are so many other factors that apply to my well-being. That includes, excuse me, everything from sleeping well to energy levels during the day, any pain or fatigue, respiratory issues, all of these factors that come into play. And, those are all things I talk about at clinic and we assess. I do PFTs with my pulmonologist, and then, that factors into respiratory issues, factor into my overall well-being. And then I talk about, if anything, if there's significant disability progression going on or anything like that. Those are all factors that, while treatments are very important, there are a number of other daily things, part of my life that I need to address at clinic. And Dr. Smith, I don't know if you have any others to add to that, or things you bring up with patients.
I think, obviously, yeah, the treatments are, the pharmaceutical treatments are amazing. I mean, that's really revolutionized care, but it hasn't made SMA go away entirely. And I always approach clinic as an opportunity to hear from the patient or the family, sort of, is there anything in particular you'd like to address at this appointment? Is there anything that you think we might be able to help with? It's a little tricky though, right, Kevin? Because a lot of things in SMA, especially in type 2 and then more so in type 3, change relatively slowly compared to some other conditions. And so it's almost like, well, this is my norm. Maybe an OT or a PT could help out with a piece of equipment or something, but you might not think about it because no, I just, this was a gradual change and I have compensated for that. And this is how I deal with that. When there might be a much better way or a better way or easier way to deal with it, whatever the issue might be.